Welcome to Webinar Wednesday. We have a great presentation for you today featuring Ray Laxton of Sutter Health and Kyle Holetz of Nuvolo. Ray and Kyle will discuss what you can do now within your CMMS to make your healthcare organization more prepared to respond quickly to the next big emergency. By their very nature, emergencies are unpredictable, but Sutter Health has developed tools within its CMMS for ensuring it's more prepared when the next emergency occurs, whatever form that emergency takes. Webinar Wednesday would like to thank our sponsor, Nuvolo. Nuvolo Connected Workplace for Health is where support teams like HTM, IT, real estate, maintenance, supply chain, pharmacy, clinical care, and more work together on one platform to support the doctors, nurses, and all care team staff. To learn more, please visit nuvolo.com. A few announcements before we get started. If you haven't already registered for our upcoming MD Expo, there is still time. Join us in Dallas, Texas on April 16th and 17th. Our pre-show planner is available for download in the handout section of your webinar dashboard. Please look it over and visit mdexposhow.com for details, registration, and our steps for a safe and clean meeting environment. While you're there, please make sure to sign up for our newsletter so you'll always have the most up-to-date information. Let's give one lucky attendee the opportunity to win a newly designed Webinar Wednesday t-shirt by answering the following question. Who is the CEO and founder of Nuvolo? You can find the answer by visiting our sponsor's website, and please use the questions feature on the GoToWebinar dashboard to submit your answer. As always, today's webinar is eligible for one continuing education credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey. More details on this at the end of the webinar. We'll wrap up today's presentation with a live Q&A. You can submit your questions using the questions feature at any time during the webinar. We'll answer as many questions as time allows. As I mentioned earlier, our speakers today are Ray Laxton and Kyle Holetz. Kyle, you may begin whenever you are ready.
Thank you very much, and thank you for all the attendees that have signed on today. I'm looking forward, I know Ray is as well, for the opportunity to speak with you all and show you a little bit about how we can use our CMMS to both prepare and respond to really any emergency. You're going to see a lot today around the current sort of pandemic, of course, with COVID, and a lot of it's going to be slanted towards that. So hopefully people aren't too tired of talking about that quite yet, but keep in mind, everything we're talking about today could absolutely be applied to a number of different emergencies. Ray, why don't you go ahead?
Good morning, Kyle, and thank you. My name is Ray Laxton. I'm the Administrative Director of EQIP. That's our brand name for our Healthcare Technology Management program within Sutter Health. We're located in Northern California. We have 24 hospitals, multiple medical foundations, about 20 plus freestanding ambulatory surgery centers, and hundreds of walk-in clinics and doctors' offices that we support, providing the majority of the service in-house.
Thank you, Ray. And my name is Kyle Holetz. I'm here at Nuvolo as the Director of Healthcare and Operational Technology Security Solution Consulting. Long background on both the ServiceNow platform and also providing niche solutions to highly regulated asset and maintenance management markets built on the ServiceNow platform. So looking forward to showing you guys a presentation today. Thank you. And I will pass it back over to you, Ray, and move on to the next slide.
All right, thank you, Kyle. Well, at Sutter EQIP, our HTM department, we start every major meeting. We review what Sutter's mission is. And in this case, it's we enhance the well-being of people in the communities we serve through a not-for-profit commitment to compassion and excellence in healthcare service. But we always like to remind ourselves of how we fit into that mission. So EQIP exists to provide effective, reliable, and affordable clinical technology solutions that enhance excellence in patient care within a safe healthcare environment. And you see the tagline at the bottom. These are goals that we have to be safe. And this is Sutter-wide goals: safe with zero harm, personal, and the top quartile for patient experience, affordable, 4-star total cost of care, and accessible, 75% of lives touched in new ways. And then we highlight in green the things in our purpose statement that directly relate to these goals. So on the next slide, talk a little bit about what we are going to share today. We'll talk about disaster preparedness, ventilator utilization tracking and management, infusion pump tracking and management, COVID equipment management, lessons learned. Before we go any further though, I'll talk a little bit about our CMMS. We're currently using a SQL-based database. It's outdated and has been under-resourced for several years, but we have an in-house development team that's done a phenomenal job of keeping us going, and we are in the middle of transitioning to Nuvolo. We go live in a couple of months. So anything we're doing in our current database, which we call PSDS, will be moving over into Nuvolo. So that's just to show you that the things we talk about here can be done in whatever database that you're using, whatever CMMS. So we'll talk a little bit about disaster preparedness. And in California, we have the advantage of preparing, I guess you would say, for multiple types of disasters. So Kyle, sorry, you got the right sheet up here. No, you're absolutely correct. I'm sorry, Kyle, I messed you up there. So there you go.
You're fine. Sorry about that, Ray.
No, it's always trying to get the two coordinated here. So we have had, in particular, we've been able to test our disaster preparedness site checklist, which is not necessarily a good thing, but we had the same hospital that we had to evacuate 2 years in a row due to wildfires. We're getting into our wildfire season here as well. We've had floods, there's earthquakes, and we all have experienced the COVID-19 pandemic. So developing a checklist is something that you'll want to do if you haven't done that. And there are many of the things on here that you'll get that information from your CMMS. So in our checklist, the first thing we do is we listen for whatever is going on. We coordinate with the emergency people and with the administration to determine any help that they need from us. Some of the specific things that we do that are on our list is coordinate any shutdown of medical equipment with service personnel, clinical staff. And we recommend that you identify those devices in your CMMS. And one of the things we'll talk a little bit about, and I think Kyle will also share this, is creating a kind of an emergency preparation dashboard, for lack of a better term, creating a list of reports that you'll need to create. So you're not trying to create those on the fly. You're able to create them in calmer times when you're not under stress. So the next item that we look at is we generate a CMMS report of all the current medical equipment that's involved in whatever the crisis is. MRI is a particular thing that you have to pay attention to, so we secure all the MRI access point, but then you also need to alert any of your support vendors and make sure that they're going to be able to provide the level of support that you need. And Kyle will show you how you can develop a list of those vendors by device type in your CMMS. Then one of the other things that we've learned is that, as I said before, we've had to evacuate the same hospital 2 years in a row. When patients leave, they take equipment with them. So develop a system for tracking all the equipment that leaves. And in our case, they went to 5 to 6 different locations. So you'll want to document that in your CMMS so that you can get your equipment back after the evacuation. So next up, you want to identify and coordinate any surplus equipment that's available and needed. One of our managers here, Curtis Farley, manages a CAMP program, Clinical Asset Management Program, where we track and maintain and deliver surplus equipment in our warehouse. You'll want to identify internal resources needed to support the mission critical service support requirements. And to do that in your CMMS, you have probably assigned a primary and a secondary technician assigned to each device. So running that list, you know who to reach out to. Next on the list, identify and alert support service vendors. And again, what you're looking for there is that they're going to be able to support any, whether it's a repair or whether it's just ramping something down or up or providing extra parts. So you're going to want to coordinate that with your vendors. Coordinate critical medical equipment power needs with facilities for any temporary situation. Sometimes if you're moving into tents per se, you're going to need to coordinate the connection of those to portable temporary power. So advise staff, again, advise staff on tracking, logging any transport equipment that went with the patient. So one of the other things that we do is we have to comply, while we're doing this, we have to comply with life safety code. So on the next slide, one of the things that is a requirement is that you have to document before you can reopen that there is equipment there, there's sufficient equipment, and that it's been approved for reuse by the appropriate authorities. And usually what they're looking for is that you have documentation that it's been inspected, tested, and that maintenance has been performed. Some of the things that you may need to do in the case where with wildfires that we found, some of the equipment will come back with the smell of smoke, just like the hospital does. So you'll make sure that you clean and disinfect that as well. So in the recovery and resumption of the hospital services checklist, again, just reach out to the affiliates and identify any needs that they have. Determine if any of the equipment was damaged, and then identify and coordinate the required resources to open the affiliate. And I have to say the team here is phenomenal. Every time that we've had this happen, we've reached out to the team for extra people to come in and help. We have always received more volunteers than we were able to use. We have a tremendous team here. Request any equip resources or HDM resources needed for repatriation of equipment. Validation efforts is needed or required for regulatory audits for relicensing. Again, you're going to generate these reports out of your CMMS. Then notify the vendors again that one of the things we found is that when natural disasters occur, they cordon off areas. The police will block access to those areas, and you'll need to provide information to the emergency responders there so that your vendors can get in. And then engage the vendors to make sure you expedite any service or parts needed to validate the equipment operation as needed. So on the next slide, we have a tool that was developed for a SQL database called MERS Medical Equipment Reporting System. And we activate the validation tool on MERS website for documentation of critical equipment validation. In other words, we use that tool to identify all the actions that we've taken, and we follow each of the necessary steps. Then you'll want to be on site as the survey is occurring to be able to relicensure or open. And then we alert the Sutter Health Emergency Management System logistics lead of any medical equipment needs and the timelines for that. We contact Curtis at our clinical asset management program for removal and storage of any damaged assets for insurance purposes, then identify and address any support service gaps. So that's just some of the things that we put in a checklist. Again, we've had the opportunity to check this twice. We also identify emergency power in our CMMS for each of the critical systems, especially high-end imaging. So managing the pandemic was a little bit different, and all of you experience this to one degree or the other. But we had to track use of ventilators, and we started out looking for those ventilators that are capable of treating adult intubated patients. As the pandemic continued and we began to learn more, we were also asked to include BiPAPs in that list as they were using more and more of those. So we created our development team in MERS created this application. It's on a web page for us where we document the type of equipment. And you can see the classification here is there's BiPAP, it's class 1, 2, 3, and 4. And that's an internal designation of the level of support that the vents provide. So a BiPAP would be a class 1. Something up to a high frequency ventilator is class 4. So we identify the number of the inventory, then we look at the number in use. And we did that by creating a manual entry for the respiratory departments to go in daily and identify how many devices are in use. It tells us the total percentage available. So for example, on this one right here, when you bring up the AM and PM, that reporting is they have to report by 6 AM and by 6 PM. This was obviously ran during the morning, and these two affiliates here had reported as identified by green. It's light green if they report, but it's late. It's pink if they reported even later, and it's red if they didn't report at all. So here, when we bring it up, it tells us what ventilators this particular affiliate has. It also gives us the information of the respiratory director, their work phone, cell phone, so we can contact them. So it's one place to go to. And then they list the different types of ventilators that they have. So on the right side of that, total in inventory for this particular device was 1, and there were none in for repair. Total in use was reported as 0. So there's one of those available. We use this information as we look at determining if someone needs ventilators. We take the ventilator, Curtis and his team, transport that equipment from the owner to the loaner, as we like to say. So on the next slide, a little bit more detail on this. Again, so we can sort this by manufacturer. And so if someone says, I need for example, I want a air curve 10ST BiPAP, I can hit the drop down box here. It'll tell me what affiliates have those. We also track the utilization. You can see if it's green, if it's, I think, 60% or above available. And once it gets between, say, the 45 and 60%, it's yellow, and below that, it's red. So on the next slide, realizing that we were going to be moving ventilators from one place to another, and that the affiliate that's getting the loan device may not be as familiar with that device. So we wanted to create a resource page for the respiratory technologies. So in this one, we happen to put in the VDR4 as a model made by Percussion Air. And you can see that we have some documents. So there is a quick start guide that was devised for this type of environment. We have pictures of the proper setup, a list of supplies that are needed, and then the operating manual. So it's one place that users can go and get help with these specific devices. Well, the other piece of equipment that was a critical need during this pandemic was infusion pumps. We are currently on the Alaris platform, and we were able to reach into the server and identify when the pumps are turned on or off. And we tracked the ones we were looking at most closely would be the controllers and the LVP modules. So we can see a total count of those and what percentage that makes up that are in use, the percentage that are available. And you can see the legend over to the right. For this example, Hospital 1, they have 761 of the controllers, the 8015 controllers in their inventory, 1 in for repair, 152 in for cleaning. And then, by the way, that's an estimate. We take a certain percentage, and then the total number in use. And we're able to go into the Alaris server and say what devices are turned on. Now, it's not completely accurate in that if you have it turned on sitting in the hallway, it still registers as being on and in use, but we figured that's a more conservative approach, so we were good with that. So in this case, they have almost 61% of their controllers available. Then we move over to the the large volume pump modules, the 8100. This same hospital has 1,048 of those, 9 are in for repair, 157 estimated for cleaning, total in use of 260. When you subtract all those, it says 27% of them are not available, or 602 are available, 57%. We do also look at the PCA modules, syringe pump modules, and the end-tidal CO2 as well. So I would say the other thing that we had to put into place was, as indicated, we have a warehouse where we store equipment, excess equipment. And in this warehouse, you can see that we had 328 excess controllers or controllers available for loan, and 387 large volume pumps. It's a combination of what we owned and then what we rented from other organizations. So as we loan these out, we have to track them and know where each of the devices are, because you're going to have to get them back. So we track the hospitals across the top, how many we've loaned out to each of those. We also had patient monitors, and you see the numbers there, and then we track the ventilators. One of the things I'll say that one of the former managers we had here, Joe Fischel, created a concept called ICU in a box, and that's where we set up the patient monitors, infusion pumps, and ancillary equipment to go with that, and that was very valuable to us as we reached out to help our affiliates in need. So the last thing we did, though, on the next slide, was we tracked devices that were loaned from one organization to another. We started out being the conduit for that. We quickly learned that it was easier to have the respiratory people reach out to their peers. And the reason for that is because they say, well, I don't have the model you're looking for, I've got this one, and we think this would work for you, and here's the information you need. And we did find that to be very successful. What we did then was we coordinated through transportation. So from Hospital 3 loaned 2 Avita V500s to Hospital 10, 2 of the V60s to Hospital 13, 4 Avita 500s, Hospital 14, etc. This is really critical, because one of the things that the owners were concerned about was, how do I know I'm going to get my equipment back? So we had to show them how we're managing this to be able to track the equipment and get that back. I will say our COVID volumes are down significantly. We're waiting until after the spring break to see if there's a surge there. And then we're going to start bringing some of these loaners back to our warehouse. But the moral of this story is, as you get rid of some of your older equipment, for example, we had some 840 ventilators that we replaced with the newer 980s. We kept the 840s and we got those transferred to eQuip so that we could manage those in the event of a crisis. The downside, you have to do PMs on them, but the upside is you're able to distribute them pretty quickly should a crisis occur. So on the summary page for my portion of the presentation, some of the things we learned and some of the areas where we didn't do as well as we could. We knew we were going to have to track ventilators and infusion pumps, but didn't do the best job of saying, what's the other ancillary equipment that you're going to need? And for example, if you're going to have a lot more patients intubated, you're going to need more feeding pumps. So you have to think through what that process is and consider the other ancillary type equipment that will be affected and track that as well. The other thing, as you increase ICUs and CCUs, that's going to trigger more infusion pump utilization, more IV poles, vital signs monitors, increased patient monitoring. So again, the recommendations as you're replacing some of the systems, consider how you might be able to redeploy those in a crisis. We were able to take some of our older patient monitors and set up independent network device. They weren't on the, say the Epic, they weren't able to connect with Epic, but we could set them up as standalone monitoring systems. So as I said before, if you increase ventilator usage, you're going to increase feeding pump utilization as well. I talked about the ICU in a box. The last learning that I took away from this was Gemba, and that's a Japanese word, which means the actual place. And in lean terms, they say that's a place where value is created. So doing a Gemba walk means getting out there, see what the workflow looks like. And when we looked at our infusion pump utilization, we said we can tell when it's turned on, when it's turned off. So we'll make some other estimates, and we felt pretty good with that. What we didn't fully understand was exactly what their flow is. Some of them stage infusion pumps in preparation for patients being admitted while the infusion pump isn't being turned on. It's really taken out of service for other things. And then the other thing we didn't take into consideration was intermittent infusion. So you can have an infusion pump in a room, treat the patient, turn it off, come back later, treat the patient, turn it off. Well, that turn off and on affected us. So those were some things that frankly we just didn't take into consideration in the beginning and had to learn more the hard way. So with that, I'm going to turn it over to Kyle, and he's going to show you how you can continue to use your CMMS in preparing for disasters.
Great, thank you, Ray. That was fantastically educational. And you know, one of the things I would just hit on, you know, as I'm going through this is you made a couple great points around two things that we, you know, like to preach and keep in mind when we're talking about CMMS, especially with, you know, making configurations to it or figuring out how it can support us in a particular emergency, right? Those two things that you continually hit on, Ray, that I want to call out were the people and the process, right? You mentioned the group that you have with your dev team that's in full support can rapidly add items to different applications, not just the CMMS, right? The end user portal that you talked about having respiratory care involvement with. You also hit the process point by talking about developing site checklists, right? And those are two fantastic areas of insight, because the CMMS is only going to allow us to visualize, report against, and tactically sort of help us make decisions based on what's there, right? Based on what data is already in the system and that we ultimately are supporting with our people and our process, right? So that's one area I like to call out, because everything I'm about to show it is really sort of ancillary, add-on metrics, add-on data based on what Ray just covered, right? So you're going to see a lot of interrelation between the topics and sort of different things to think about as we think about what Ray just presented across the board. What are some of those other ancillary items that we could legitimately track and ultimately get a really good idea about parts utilization, PM forecasting, right? All of those tactical things that help us make decisions. So thank you, Ray. And as I'm going through this, please add color anywhere you see it necessary. So one of the things that you talked about that I want to hit on is the ability to rapidly create documentation in the form of dashboards, in the form of reports, whether they be created before an emergency or after, right? One of the great things about modern CMMS systems as a whole is that a lot of these reports and dashboards, think of them as templates, right? A report or a dashboard that you make specific to COVID, for example, right, around ventilators or ancillary ventilator equipment, that can be reused for other purposes, right? Your fire trainings, your flood reports, earthquake, things that you want to track in those situations can absolutely be reused. So there's not the necessary need to create one-offs every single time an emergency takes place, because there could be something that's, you know, 80% fits the bill, for example. So what you're seeing on my screen now is an example of housing a lot of that information in one place. So for the purposes of this webinar, I created a dashboard, and keep in mind, these reports take minutes. These dashboards take minutes to create, very, very simple, to look at things like ancillary equipment, as Ray had mentioned. We know what ventilators we have, and it's very important to know, well, with that ventilator, what is common equipment needs that come with it based on the treatment, based on the emergency, right? So you can get an idea of particular ancillary models of equipment that are used with the particular LTV ventilator. And then down below, a quick search to know exactly how many of those devices you have, right? So I don't need to span between different areas. I know what I need, and if I'm gonna uptick, you know, loan or rent a number of these ventilators, I know what might need to come with it, and I can quickly find that down below in exact numbers based on the numbers of ancillary equipment that I have, all from one dashboard. keep in mind the next step that comes with that, once I know my need, right, where am I going to get that need from, right? So in this case, we've really just added a list, and keep in mind a lot of this is demo data from my system. So if some things look a little funky, that's just simply because there's some demo data in this environment. But looking at things like rental companies, so we might need to rent that ancillary equipment. We might need to rent more pumps, more ventilators, things like that. Who can I get them from, and how can I very quickly display that onto a dashboard that technicians can use, maybe put it on the portal that the respiratory group is using. There's a lot of different options for this. Next, simply knowing how many of the particular devices you have. So one of the things that Ray mentioned is just having your inventory across sites, right? Again, something that can very easily be housed in a dashboard, just like you see here, looking at manufacturers, models, you know, what location they're in. That could be a site code or a warehouse or something of the sort, and what department owns them. Lastly, keeping on the topic of ancillary needs, is parts, right? So as more utilization is uptake, as more rental units or loaner units are brought into the hospital, what type of parts are we going to need to use that equipment for various different treatments that might need to be done? So at the bottom here, the last report that you'll see is we're looking at this based on models. So if we're going to bring in a number of 840 ventilators or something of the sort, what parts are commonly related to that equipment that I might want to keep in mind that I need to buy more of these because there's going to be more treatments and I'm going to need to replace those particular parts. So again, having this data at your fingertips allows us to make those decisions with more confidence when these emergencies take place. Ray, I'll pause and ask if there's any color or adds you'd like to make for this first 2 slides here.
No, Kyle, I think you did a great job of talking about how you can take the information that you've already got in there and then create easily accessible reports. And I would agree with you when you said it takes minutes. It literally does take minutes to create these kinds of dashboards.
Yeah, thank you. All right. So what you're going to see now is a number of, after we kind of talk about the dashboard being in one place, we're really going to start getting into what is some of that other data that we should be looking at when we're thinking about an emergency, right? It's going to affect different types of equipment. Different types of equipment are going to be needed for different emergencies. In this case, we're going to stick, you know, with what's happening now with, you know, COVID-19 and in particular ventilator use cases. So the next thing that you'll notice, and I try and keep these in terms of a logical order of operations, is looking at PM future part use, right? So we know when our PMs are going to be done, assuming that we can report against it. So knowing what parts am I going to need for my current asset inventory. So I can see very simply through reports here, and some of these are backdated just because it's a screenshot from a part forecast report in the system, but you can start to get an idea month by month, what parts do I know that I'm going to need for my PM workload, right? This is very important information when you're starting to drive mass purchases and things like that. And chances are you're going to be bringing in devices that you're going to have to do PMs on that might not be yours, but they're going to be the same models of equipment. So we know what parts they will take. The next thing that's important to look at is failure rates, right? So looking at the same types of equipment, we know what kind of PMs are taking place. We know what kind of part kits might need to be used for those PMs or just for those treatments, right? The next logical thing to look at is generally failures, right? So if I can overlay that PM information that I have with failure information, that can be very helpful. So based on looking at, you know, this could be physical damage, it could just be device failures as a whole, right? Looking at what parts are being, you know, used for these sort of corrective maintenance work orders. Again, overlaying this data on top of the preventative maintenance information that we've just showed can start to get us relatively accurate parts forecasting needs for both the equipment that you have now and is going to start being used more in an emergency situation, and the equipment that you might be bringing in to the organization. And I wanted to try and add some additional color on, what Ray had talked about, keep it towards ventilators, keep it towards pumps, but also sort of add an overlay of additional information that might not have been covered that's worth thinking about. Ray, anything to add here?
A little bit. You were talking about PM parts. And one of the things we learned with COVID-19 is you want to identify any PM kits or anything like that that you might need quickly, because we found out that some of those get sold out. So the faster that you're able to identify those things and get them on order, the faster you'll be able to get them.
Yeah, absolutely. And again, one of the nice things about these reports, you'll notice they're all pointed towards ventilators, right? And that could be a wildcard search against ventilator asset types. It could be done a number of different ways. Once that's created it's a template. It's a copy and paste exercise for your reports to change this to imaging modality, pump modality equipments, right? So on and so forth. The last piece to look at, and Ray talked a lot about this when he's talking about the warehouse that they have with their CAMP program, is looking at devices based on current part inventories in that warehouse, in those various stock rooms, right? So we know what parts we're going to need. Now the question is, well, what do we have, right? So with this record here, this is just an example of a feeding tube. And ultimately, we can start to understand, okay, across our different sites, and you can see 4 different stock rooms here on the bottom, across our different sites, across our different stock rooms, where are we going to have the largest, not only the need for these parts based on the treatments that are going to be done, but where might we be short, right? So we've collected all the average data that we know that we're going to need from PMs. We've added the average that we know we use from a corrective maintenance standpoint. Looking at that then against the current assets the current parts, this is then exactly what Ray mentioned. Where's my biggest need, right? Well, if truck 1 is sitting at one of our, if truck 1 is sitting at one of our high patient, high treatment areas, we know where our priority lies in terms of where we need to order parts and where we need to order them quickly, right? So to piggyback off that example, looking at the current details of this information can be helpful to both prioritize where we should be sending these things and just if we need more, right? You might have a lot of these things in stock, but again, it's hard to report against unless we're tracking it and it's truly tracking that data in the system. Additionally, a couple things I'd add onto this is one of the things that you'll notice is one of the things that's nice about the modern CMMS systems is the fact that the data is always related. There's always an insight into another area of the application. So even from this screen, you can get an idea of the 3 models of equipment these parts are directly used against, and that correlates then to 22 assets of that model. So again, just kind of providing that one-stop shop to help make those decisions and help move around the equipment and the parts as needed. The next thing that's important to look at as you're preparing for additional equipment to come into the facility, whether it be loaners, whether it be rentals, right, things like that, is the end of life data that you might have against that equipment, right? So what we see here on this report is both end of life information against ventilators and various models of ventilators. What we can see here is both the manufacturer, where they're located, what department they're in. So if we start to see stack ups of end of life devices effectively coming from particular departments, again, it helps us to prioritize where we should be sending that equipment and where we should be renting things to. Additionally, if it comes down to purchasing new equipment, this end of life data can be used to then look at the acquisition cost of the equipment based on site, based on owning department. We can extrapolate these reports in a number of different ways, ultimately showing, based on the last time we bought these things, this is about how much it's going to cost us or what we estimate this costing us in the future if we're going to purchase as opposed to rent or loan. Additionally, looking at condition can be very important. So knowing, at my different departments, I can see my respiratory care department here. These reports can be stacked by, as you can see down on the bottom here, site, department, operational status, or something like condition, which is what it's stacked by now. This helps us to know, again, where's that need coming from? And if we're having a major influx of patients into a particular department or a particular site, we want to make sure that that site doesn't have all of our old equipment, right? And the condition of that equipment is in good shape, because there's going to be a major uptick in utilization, and we don't want to have to necessarily be dealing with additional failures that we might not have thought about or prepared for. Ray, anything to add here?
Yeah, one thing I would add is, just like we ran through the list of ventilators and we knew we were going to need to buy more, using the end of life report to identify those that were at end of life, but we knew we could continue to support them, and then replacing them allowed us to keep the older ones in use. So we had excess equipment, if you will, that we could continue use. So that's another way to use the same report.
Fantastic. Thank you for that. All right, moving on. The reason I like to talk about this one is training purposes, right? When we're bringing in new equipment, as we're renting and loaning things, we want to make sure that the equipment that we're bringing into the hospital, the clinical engineers, right? We're not the ones using the equipment for treatments. There's a whole population of clinicians out there that are actually using this in care, obviously, right? What can we do, though, as a piece of that? We can start to look at things like failure types. So if we are going to rent a number of different equipments, let's extrapolate, look at or quantify the failure codes or the problem causes in the sort of our PCR tree, and look at, well, how are people actually using the equipment, right? What this then gives us insight into is, well, what models are used best by the end user population? For example, I see right off the top at this top bar here in the report, there really hasn't been any device failures based on this high frequency ventilator model. It's been all physical damage. What that gives me insight into is how the clinicians are using the equipment, and maybe that's not the best route for us to rent, as we can prove that when they rent these, or when we bring these devices in, the folks just don't simply know how to use them the best, right? And failure, sort of physical damage work orders start going up, as opposed to the device failing, right? Or a part failure or something else of the sort. So insight into training, insight into where those sort of unknown issues might lie, like this, can be very helpful in making those rental and loaner decisions ultimately. The next thing is a piggyback off of what Ray had mentioned around the ICU in a box concept. This is actually something that we worked on collaboratively. Joe Fischel, of course, as Ray mentioned, was sort of the originator of this plan. But when Sutter started talking to us about it, this was in the early stages of the deployment, we immediately thought, like, this is something we could absolutely support. You created the person did it, people, created the process. Now, how do we track it in the CMMS, right? How do we report against where these ICU in a boxes are going and things like that? So what this report then shows us is, what couple of the things that Ray mentioned were a part of that delivery process, right? We're beds. You have your level monitor, your level monitor counts here. Sorry, I couldn't quite read that, and these are kind of small, right? All of your different assets, from IV poles to the PCUs, and all the way down to ventilators, right? Dependent on the number of boxes that are delivered. So you can see your checklist here that's verifying what was delivered and the numbers that were delivered here on the left-hand side, with the clinical work order over on the right. Right? In this case, it is in the ICU in a box example, but keep in mind, these emergency response type work orders are very dynamic. We could use this for a lot of different functions, whether it be fire, flood, shutdown activities, things like that. And in this case, we can create policies in the system that support our people and support our process, so we know we're tracking the right data. What do I mean by that? You'll notice that the work order type here is emergency response, and we have specific fields then, like box count and delivered assets, that are only going to be available based on that emergency response work order type. Reason being is we don't want those fields on preventative maintenance work orders or corrective maintenance work orders. And additionally, it gives us insight into what we own that was delivered or sent out, and what we might need to rent. So that checklist then can be listed. These are asset tags that are sitting in there saying, we delivered this equipment. This was ours. We didn't rent this, right? For the purposes that technician needs to track where they're renting things from, where they might be loaning things from, and what came from their current inventory. Ray, anything to add on to this one?
You know, one of the things I was thinking about, Kyle, is because you can link these really quickly in a Nuvolo type application, you can start setting some parameters and say, if I need, you can look in the warehouse, for example, with us, look in the warehouse and say, how many pieces do I have? So how many monitors? And you can just click down, say, I need this many monitors, this many infusion, and you can tie those together, establish ratios. So basically your CMMS would be doing the work for you. And I would say it's a lot better to be doing this planning before the emergency occurs, and have something like this at your fingertips so you can quickly run that, and you're not trying to think of it when you're under a lot of pressure.
Absolutely. Thank you. Next, what comes after the sort of process of tracking all that information in a particular work order? Well, reporting against those work orders, right? So again, one of the great benefits of this is the reports don't require any sort of level of coding or SQL queries. These are drop-down driven reports that are very, very flexible. And what you'll notice is I always call it report inception. You can have a number of different reports within the same report to, for example, group your equipment delivery metrics based on state, based on department they might be going to, the site that they might be going to, as you can see here, and various other things, even the assigned to technician who's supposed to be doing that delivery. So the tracking of that equipment, you know, and its status and delivery becomes very, very important, because you're going to have, you know, clinicians deployed into those areas. They're going to be waiting to give treatment, and they're going to need to know the status of the additional equipment that they need that is coming in. All right, so the last thing I'm going to cover here, and this is just going to be a quick example of a rapid configuration support, right? And what the purpose of us doing this is, a lot of the things that Ray mentioned, having that dev team, building that process. The third thing that comes in is operationalizing it into your tool, right? So one of the examples that I think was really good was that respiratory class example against a make model database. Right, so one of the things that I'll do now, and all I did was switch out of my PowerPoint and switch over to my presentation or my demo instance. What we're going to quickly do is show how quickly and easily that configuration can take place. We can add those choices to classify our ventilators, and then of course report against it. So if I quickly go to my model table and I just click into one of my ventilators here, what we can then do is see all the out-of-the-box fields, the different things we've talked about, like the ancillary equipment related parts that we both kind of hit on throughout this example. What I can do is quickly come in, go to my form designer. What this is then going to do for me is basically give me a templated version of my make model field. In this case, I want to add a respiratory class field. If I type it in over here on the left-hand side of fields, you'll notice I don't have that field, meaning I need to create a new one. So in this case, I'll just grab this choice field, drop it here, hit my icon here, and for the sake of time, I'll just call it resp class and spell properly. Moving down, what we'll see here is you can then start filling out your choices. So in this case, you know, I'll just follow Ray's example, class 1, class 2, class 3, and one really important one that I thought was interesting was the configuration. So this will say one is config capable, right? For the sake of example here. We've now added those choices to our field. We can then come back, save this record or save this new sort of form design, assuming that it took, and it did. As soon as I then go back to my page, what we can then do as soon as this loads is you'll notice my respiratory class field is immediately actionable on my form, right? The next thing we can do beyond that is I'll navigate back to my model table and start reporting against it, right? So what I can quickly then do is say, well, I need that field out on in my list view, so I'll move it up here so it's a little easier to find. Hit OK. Quickly say I only want to look at wildcard search against ventilators, so I can just say, you know, a vent here. Here's all my make models of that contain vent in the asset type, excuse me. And then for sake of example, just quickly come in, mass update these, say these 2, 3 are class 1s. You know, we have a configuration capable here, and these ventilators are of course classified, we'll say as class 3. Now, of course, this would come with some level of working with your respiratory care department, but I hope that everyone gets the idea. From here, the last thing we could do is build a quick report against this. Say, all right, I want to know how many sort of different classifications of ventilators. Obviously, in your guys' case, this report might be much larger. I was looking at this from the make model table, but you can start to see how many models of ventilators you have that are of different classes, and then immediately vents add it to a dashboard. So once I save this report, just for the sake of example, this one's relatively simple. We could, of course, then come in a little bit deeper, stack this information by, owning department or by the model name, things like that. We might as well just add that in here. Model name should be in here somewhere. Instead of searching, I'll just move on. But we stack by something like the model name. And then the last thing we could do is add it to a homepage or a dashboard, right? So I could come in, put that on my manager dashboard here, and immediately have an applicable report sent to a dashboard that I can then use. So the last thing you'll see is if I scroll down, I then have my new report sitting on my dashboard that is completely actionable for me to click into and know exactly what make models are configuration capable, and then of course how many of those devices we might have of that model here. So with that being said, that was the quick demonstration that I wanted to go through to kind of show you how we support that rapid configuration in the case of an emergency. That wraps up everything that I had to cover today, and I believe Ray as well. I'll pause and ask Ray if there's any last comments or color you'd like to add before we turn it over for Q&A.
Well, Kyle, I think you summed it up pretty well.
Thank you. Well, thanks everybody for the time, and I think we'll just do some Q&A now, and I'll turn it back over.
Thank you so much, Kyle and Ray, for all of this valuable information. As a reminder to our audience, if you would like to ask a question, please use the question feature on the GoToWebinar dashboard. We do have a few questions that have come in already. Let's see. The first one is, what was the timeline that it took to stand up the functionality around disaster recovery that Ray presented on?
So we actually we have two remarkable developers in the house here. They stood that up in less than a week.
Wow, okay, that's fast.
Yes.
Our next question is, how did you get the clinician staff to support your efforts in tracking equipment and work in the examples given?
That is a great question, and that's a difficult one, but it has to start at the top. It actually came from our SHIMS, Sutter Health Emergency Management System. So that's something that they required to be able to track. The state required us to track ventilator utilization, and so we had to have a way to do that. There were some other efforts to get the information directly out of Epic, and they weren't detailed enough. So in order to comply with that requirement, we're able to send the information out to the respiratory teams. I would also say I partnered with one of our local respiratory therapy directors who was immensely helpful in pulling all the leaders together in conference calls and Skype meetings, explain the need for them, walk through the utilization of the tool. But so I would say it's a combination of that communication and then having that information come as a request through our emergency management department.
Thank you, Ray. Our next question is, outside of some of the changes in the CMMS system that supported you, what kind of people and process changes did you make that aided in disaster response?
So repeat that if you would.
All right. Outside of some of the changes in the CMMS system that supported you, what kind of people and process changes did you make that aided in disaster recovery?
All right, thank you. So I think
Sure.
On the people side of that, I'll give two different responses. One for like the fire example that I gave. We coordinate those through our operations team, and our operations team set in the daily meetings for that affiliate. Then they communicated that up to our leadership, and then we identified our technical resources that we were going to need and got a pool of people that were available. On the pandemic side, if you will, the biggest coordination that we needed was with our team since we were the ones that were going to be collecting, say, a ventilator that's going to be moved from hospital A to hospital B. One of our staff would collect the equipment on the owning side, and then a courier would pick it up and deliver it. Our staff would pick it up on the other side, do the in service and the incoming check on that, and get that information entered into our CMMS. So it was coordination for our technical staff to assist in the relocation of those devices. We have weekly meetings, and we set up all hands meetings frequently if we have emergency information we need to communicate, and that has served us well.
All right, our next question is, do you have access to the Alaris software to determine how many pumps are in use?
We do. So we went through Alaris to get access to their server, and that was a really powerful tool. I will tell you the other way that we were able to use that information is we're actually transitioning to a different large volume pump. And so determining how many pumps we need, the estimate usually is much higher than what we were seeing as far as our utilization. So we're able to do, we have a remarkable clinical engineer. The team there is led by Steve Shimose, and Anna Orekwe is one of his clinical engineers. She did some remarkable work in analyzing our utilization data, looking at census data, and then communicating with the sites to determine what we should actually order. So I would say if you're using Alaris pumps, I would reach out to Alaris to get access to that server. Again, it will tell you when it's turned on and turned off. And we found that to be a very valuable tool.
Thank you both, Kyle and Ray, for your time today and for a great presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the services they provide to our industry. Please visit nuvolo.com. A quick reminder that you can obtain your CE certificate by completing today's post-webinar survey. The survey will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 continuing education credit from the ACI. You'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We will be back next week with another webinar. Please visit webinarwednesday.live for more details and complimentary registration. Thank you all and have a great day.
Thanks, everybody.